This is the Turn Autism Around podcast, episode number 233. Today we are talking about marriage counseling and autism and what couples therapists need to know about the struggles that families are facing with autism. It's actually a lecture I did for couples therapists, and I really put a lot of time into it. So I think there's a lot of gold in here. I don't know if I've ever brought this up in the podcast. Maybe I did before, but my husband and I did get recommended to go to marriage counseling shortly after, actually at the appointment when Lucas was diagnosed. So we did seek counseling. I talk about that a little bit, but whether you're a parent or a professional, I think this is an important episode to learn about the struggles, the divorce rate, and what we can do to make couples have better relationships with themselves and their kids. So let's get to this important episode all about couples therapy.
I am delighted actually to bring Mary Barbera to all of you today. I first actually heard Mary speak at a conference that I went to several years ago. And I loved her approach, her enthusiasm, the way she was empowering parents. And then I was fortunate enough to meet her at a mastermind group that we both belong to. And since then, we've been working on finding a date that worked to bring her to all of you. And so we finally have arrived at that date. And I'm going to have her tell you her own story, which is a very compelling story, and she will talk about that, I'm sure. But before I turn it over to her, I really want to recommend her book, which is Turn Autism Around. And Mary's work and her approach in this book is so designed to help couples and families immediately when they first really have any sense that there might be some issues with their children, and not have to wait for the long medical system or a diagnosis, but to begin to be able to really help them right away. She's got amazing strategies for parents for tough things like potty training and bedtime, and I'm sure she'll touch on a little bit of that. But I asked her specifically today to speak about her focus on the impact of autism and children on the spectrum on couples and families. So like I said, her approach is super empowering. And Mary, thank you for being here, and go ahead and take it away.
Okay, thanks, Ellen. Happy to be here. And like Ellen said, we've known each other for a few years now. And I will tell you a lot about my story as we go. I'm going to share my screen now, and this is recorded. I usually don't give out the PowerPoint, but this being a closed group and being professionals, I did take out a couple of videos that I'm going to show. I left in a couple of videos though. So, Ruth, maybe you can post that, or Ellen, you can post the link to the Dropbox to get the actual PowerPoint where you can watch it later, print it out, take notes. You don't have to write a lot, since you will have the actual PowerPoint with all the words on it. So let's get started. Today, we are going to talk about the prevalence, key characteristics, and struggles of children on the autism spectrum disorder. Identify common challenges couples who have a child with autism often face, the need to know information when providing counseling or support to these couples. I am going to cover 3 action steps to take to start turning autism around. And I know that many of you are not in a position to be taking the action steps and actually working with the kids. But I think if I give you these action steps, if everybody can mute themselves, I feel like I'm getting some feedback here. So I know you're not going to be the ones necessarily doing the action steps, but I think it will be helpful. Like when people are like, well, what do I do if he does X, Y, and Z? And you give advice, it may not be what I would recommend. And then we're going to talk about resources for parents and professionals to learn more about autism. Ellen already held up my book. I have other resources, and I have, just a lot of information. So we're only going to go for, this session is going to be an hour and a half. We're going to have plenty of time for questions. We are leaving the chat open. If you have questions as we go, my assistant Rachel is here as well. So she can answer your questions. If there's a resource that I mentioned, she'll be putting that in the chat as well. And we'll be doing question and answer at the end. So I have a basic idea of who's here, but we have some that are couples and family therapists and social workers, that sort of thing. Some of you are in addition or instead psychologists. And then we probably, with the rate being such that 1 in 44 are affected, which we're going to cover, there's probably some parents and grandparents of children with autism and toddlers showing signs that are also here. So in the chat, I would like to know who's here. If you can put 1, 2, or 3, and any combinations, it'll help me see who's here, and make sure you do it to everyone if you're comfortable. Okay, so we got 1s and 1 plus 3. Lots of 1s, 1, 2, and 3. Well, you get the award, Amy. 1 and 3. 1, but it has autistic family members. 1, 2, and 3. Another 1, 2, and 3. So as you can see, the people that are attending, there's another 1, 2, and 3. Very good to know. And I'm going to tell you my story because it's very much a part of what I'm doing now. And so here is back Christmas time, December 27th, 1997, when my second born son, Spencer, was born. And here I am with Charles. He was an emergency medicine physician. He still is, but now he's been a vice president of a health system, and now he's the CEO of the health system, of the hospital locally. So I thought everything was great here. I thought I had a master's degree in nursing administration, married to a physician, had 2 healthy kids, and lived in the suburbs with a white picket fence. And I thought everything was fine until Spencer was 2 months of age, and I took him to a well visit. And my husband said, well, when you take Spencer, ask the doctor how many words Lucas should have. And this is back in 1998, because Spencer was born at the very tail end of 1997. And so I went and I asked the doctor, Spencer checked out fine. I asked the doctor, how many words should Lucas have at 21 months of age? And he said at the time, 20 or 25 words, something like that. And so literally on the way home, I was like counting words, like E-I-E-I-O was 5 words. He had said ball a month prior. He had what I now know is delayed echolalia. So we'd take him to the park and there would be a sign there, please do not feed the ducks. And so they were 10 feet apart, at the park and at the museum. And my husband would take him, and he was very interested in letters, which is called hyperlexia. And my husband would read, please do not feed the ducks, any dad, quack, quack. And then Lucas would run to the next sign. And my husband would say, please do not feed the ducks, quack, quack. And in the middle of the night, occasionally Lucas would wake up and he'd go, please do not feed the ducks, quack, quack. And literally on the way home from this appointment where I found out he needed 25 words, I counted, please do not feed the ducks, quack, quack, as 8 more words. So I got home. I was not thinking autism. This is back in the late 1990s. Autism wasn't really that much talked about. There was no social media. It was a very different time. I got home. My husband said, so how many words does the doctor think he should have? And I said 25. And he said, well, he doesn't have 25. Oh, no, he does. I counted. And he didn't say, like, what are the words, Mary? Like, seriously? But he said, so you don't think he might have autism? And so he dropped that bomb. I was like shocked and confused and horrified. The only thing I had known about autism was I had watched Rain Man, and I had done a junior clinical nursing rotation at a residential placement. And were some teenagers there who were thought to have autism. And so in the 80s, that's what I knew about autism. I didn't know what it would look like in a toddler. So on that day in the family room of my old house with the blue carpet, I said, it's not autism. And I never, ever want to hear that word again. And I went into a deep state of denial, and he didn't bring it up again for several months. And we lost a lot of time. And finally, we took him, the preschool. He went to typical preschool when he was 2, thinking that was going to jumpstart things. He went to speech therapy when he was 2. Both helped, but, I didn't know how to. He had some words, what I now call as pop out words. I didn't know how to teach him to talk. I didn't know how to teach him anything. And when we were at the developmental pediatrician's office, the day before he turned 3, he was diagnosed with moderate to severe autism. And, I was in tears. We had gotten a preliminary diagnosis from a local psychologist. So this wasn't a real shock, but that local psychologist said PDD-NOS, which was confusing. That was kind of mild autism. This developmental pediatrician, Dr. Copeland at Children's Hospital, Philadelphia, was saying moderate severe autism. So it was all like a lot. It was like a lot more than I thought it was. And so I have water and milk up here. And I don't know, Rachel, my assistant's here, she probably has never even heard this story, but at the end of the whole developmental pediatrician visit, Dr. Copeland said, so do you have any questions? And my husband said, yes, I have a question. He said, sometimes Lucas wakes up in the middle of the night and he asks for milk. And Mary runs downstairs and gets him milk. And I think she should just get him water out of the spigot, in the bathroom. So what should we do? Who's right? Should she give him milk or should we give him water? And so the developmental pediatrician, after he just gave us this hugely serious diagnosis, said, I think you need marriage counseling. I was like, oh, of course we do. Because neither one of you is right. There's pros and cons to milk versus water. But if you're fighting about this, then you're going to be fighting about a whole lot more. There's a lot of decisions that are going to have to be made. And so we came out of that appointment. On the ride home, Lucas was completely silent in the car. I was crying. My husband was saying things like, he'll never go to college, he'll never get married. And I was telling him to be quiet. Like, I had read some books about ABA. I knew that the brain was pretty plastic, would have been more plastic and more changeable at 21 months. Now we were at 36 months, almost to the day. But at that point, I was, telling him to stop, like, all this pessimism and all this, I'm sure many of you are out there, you're psychologists or couples therapists. You do know kids who've done really well, who do go to college, who do get married, who do drive a car. And at that point, like, all my expectations for both my kids and everything kind of flew out the window, that whole white picket fence. I want everything to be perfect. It was like, okay, this is a big issue. So the next day was his third birthday. Here he is pictured with just a diaper on because every time I would turn my back, he would strip down. I didn't know how to teach him to keep his clothes on. I didn't know he couldn't blow out the candles. I didn't know how to do that, how to teach him to talk. This was a Saturday. It was a planned party, but it was really tough because, my husband and I were grieving. My parents were there. They were grieving, it just seemed so final, like moderate severe autism was just so big. At the time, I was a master's prepared nurse without a lot of information about autism. But I knew that starting this Monday, the Monday after this party, I was going to start making my calls and start figuring things out. The developmental pediatrician had recommended ABA therapy, applied behavior analysis therapy. It was and still is the most evidence-based treatment for children with autism. Back then, it wasn't covered by insurance. Now, in all 50 states, there's been legislation passed that it does cover it. Luckily, where I'm from in Pennsylvania, some other gung-ho parent had figured out a loophole. And so Lucas could get medical assistance regardless of family income. And he got pretty much all of his services paid for. That was very lucky because at the time, most people in other states were mortgaging their houses. So that day and from then on, I felt like I had just been dropped into a maze or like a hole, with Lucas too. Like I had fallen in and I had to figure out how to get myself out, how to get him out with me, how to get out of the maze or this hole, and then start like climbing a mountain. And it was really tough. And right now, fast forward, I'm going to tell you kind of how I went over to the professional side of things, but a lot of people now, if you're a parent or grandparent, you can relate to this, I'm sure. The waiting lists back then were only a couple of months long to get into the developmental pediatrician or to get ABA therapy started. Now the wait lists are 9 months to 2 years in many cases, and that was before COVID. So COVID also messed up a lot of things, including the waiting lists and care. So some of the struggles when you have a toddler with delays, signs of autism, or a diagnosis are one or both parents can be in denial. You need to know how to recognize the signs of autism, waiting lists, as I said, confusion, uncertainty, optimism, pessimism, hope. I did a podcast interview with my husband. I have a weekly podcast that just had celebrated 1 million downloads. And so I interviewed my husband for one of the podcasts, and we were talking about like, he was overly pessimistic. And I was overly optimistic. And he agreed, but back then we didn't have a lot of examples of kids doing really well. Early intervention therapists in your home, right away you lack privacy. And, I swear half the county has the code to get in my door. And, people just come in and go out and they leave. And, I run into people and they're like, oh yeah, hi, Lucas. And I'm like looking at them. They're like, yeah, I was Lucas's therapist. I'm like, oh, just at school? Or, oh no, I was in your home. And I'm like, I don't even remember. Different opinions, advice, ideas on what treatments to pursue, accepting the diagnosis and the severity level. That was the second diagnosis, technically, when we went to the developmental pediatrician, but there was a disconnect between PDD-NOS and then autism spectrum disorder, moderate to severe. We're going to talk about the DSM-4 changing to the DSM-5 and all kinds of, it just adds to the confusion. And then so many decisions, starting with water versus milk. So how did I go from an overwhelmed and confused parent in denial for over a year to a leading autism expert? Early on, before Lucas went to kindergarten, I was approached and found out about this verbal behavior project. And it is still going strong. It's changed its name. It's the Patent Autism ABA Initiative. And I was the lead behavior analyst in that initiative from 2003 to 2010. That initiative was through the Pennsylvania Department of Education. The special ed arm is called PATAN or Patent. In that time, I went to work in schools, working with special ed teachers, regular ed teachers, paraprofessionals, speech therapists, occupational therapists, PTs, school bus drivers, cafeteria aides, anybody that wanted to learn and would listen. I was a behavior analyst, and it was a great experience. And I got a lot of experience working with hundreds, if not thousands of kids directly. Also in 2007, after I started working with the project, I knew there was so much in my head that, and the books were really outdated. The books I used for Lucas, really outdated. So I wrote the book, The Verbal Behavior Approach. And this book was published in 2007, and it is now available in 17 languages. It also gave me the opportunity and the invitations to travel the world speaking about autism. Here I am in Australia in 2017 to a sold out crowd of 300. But the problem was I was only speaking for the keynote and maybe a panel at the end. And it was a lot of expense that they paid me, and people flew in from different parts of Australia and different parts near there. And then they'd get home and they'd be like, okay, well, Mary showed a video and the kid wasn't on the floor screaming, and I don't know what to do. And at the same time, I left the Verbal Behavior Project in 2010 to finish up my PhD in leadership. And I also started working with little kids like Cody in his home in early intervention. And I worked in the early intervention field with birth to 3 and 3 to 5 from 2010 to about 16 or 17, when I fully transitioned to becoming an online marketer. And that's, I'm in Jeff Walker's group coaching mastermind program. And that's how I know Ellen. And basically my mission, starting when I joined in 2016, is really to stop the one-to-one work and stop all the travel or reduce it, to get my message out online where people can, both parents and professionals can learn. So starting in 2015, I started creating online courses for professionals and gung-ho parents. And then just in 2021, I wrote a book that was published by Hay House, Turn Autism Around, an action guide for parents of young children with early signs of autism. And that's, the subtitle is really important because I want to get to the parents who are worried, who are waiting, who one of the partners is in denial. The grandparent sees it, but the kids don't see it. The mom sees it, but the grandparents are in denial. And I want to, it doesn't matter if it's autism or just a speech delay or a sensory processing issue, or early signs of ADHD, or early signs of giftedness, or COVID isolation. These procedures work great. Down syndrome, anything that's causing developmental delays, differences, or disorders. The Forewords by Temple Grandin, one of the most, well, probably the most famous person in the autism world. And Temple has several books. She is on the autism spectrum. So what do couples therapists and psychologists need to know about autism? I posted this. I'm creating a presentation. Actually, I was preparing this presentation last week. And so I thought I'd ask my Facebook group with 50,000 followers. Actually, we just reached the 50,000 mark this weekend. And I thought, I'm going to put this out there and see what they have to say. And I also put it on my personal wall, and I got over 100 comments. So some of the comments, and I'm going to show you where you can read the rest of the comments when you have time. But so here's a comment: 2 things. Autism is different for each individual person. And 2, family therapy is important. This woman is a MD, and a parent. of a child about the same age as Lucas. I've known her for years. So she had a lot of good points. So I just copied her whole thing. Doing things alone as a couple may not be an option due to limited or no childcare. Sleep disturbance is common in the household. Financial pressure of care not covered by insurance. Parents have to agree on an effective behavior plan, but this can be hard. ADL, activities of daily living care for a person with level 3 autism, is a big demand. Constant on alert is exhausting physically and emotionally. There was a study done in 2009 which showed that autism moms have the stress level of combat soldiers because they're always on alert, waiting for the next shoe to drop. Here's Celia Hyman, who's another friend of mine. She's a doctoral level BCBA, I believe, or pursuing her doctorate. She also has a son with autism. She said, couples do not sign up for the autism journey. And when they are forced to be on the journey, the acceptance and perspectives taken can differ. When they differ, they need guidance to reconcile. When it can't be reconciled, they need guidance to choose their own course that is best for every member of the family. The stressors that arise include isolation from friends, family, and community, financial burden, lack of sleep, mental health concerns, blame, guilt, exhaustion, lack of intimacy with spouse, parenting differences, fights and advocating with schools, with insurance, trauma from the child's challenging behaviors. So I pulled out 3 of more than 100 responses. I think that pretty much sums up, all, a lot of the different struggles and things that couples therapists need. So you can read over the comments. It was a January 4th post on marybarbera.com/Facebook. If you go on there, also like and subscribe and all that stuff to help the algorithm know that they should spread my word. Okay. Why don't we stop here and just in the chat, can you think of any, other stressors or other things that you're thinking of that aren't on this list or weren't discussed so far? One of the parents is likely to be autistic. Yeah, that's a very good point. And that I think is somewhere in my presentation, but yeah, some of the times like Eileen Lamb, for instance, she's an adult. She got her son, Charlie, diagnosed with level 3 autism, which is severe. And then she figured out that she had autism. And so you can either know you have autism or kind of like, oh, these are all the signs I used to have, and this is why I'm different or struggling. Also, siblings have a 19%, just about a 1 in 5 chance of also being on the autism spectrum. So I have been in families where you have, the 4-year-old or 3-year-old or 2-year-old getting diagnosed, and then the kindergarten students is struggling, and lo and behold, that child also has autism. So it can really kind of explode into lots of different things. Lasting denial, yeah. Sibling care, yeah. If you have 6 kids, if you have twins, if you have triplets, and one or all of them are affected. And I'm going to show you a video of a child, and she had 2 brothers who also had autism. So that was 3. So multiple children with differing levels of needs. Dealing with public judgment. And I see that, especially with kids who are higher on the spectrum, they just look like a brat. Like you can't control your kid, or they're just kind of on the edge of the spectrum. Whereas like a child like my son, who's now 26 years old, there's no question that something's going on with him. Lack of appreciation from one parent to the other. Yeah, I see that a lot. I see, the dad usually becoming a workaholic, and then the mom maybe having to give up her career or cut back on work. That's a common theme. Sometimes couples lose attendance at their place of worship. Yep. Because volunteers can't handle the needs of your child. Yep. That is totally true. Because ADHD co-occurs with ASD, likely the parent or SIB has ADHD. That's very common as well. Invalidation from parents of non-biological step parent. Yep. If the parents do get divorced or aren't married to begin with, there can be a lot of problems with the child adjusting and having different expectations at two different houses. Triangulation between couples and child. The parent, that is the primary care parent, is resentful about the lack of appreciation, misaligned workload. Yep. Treating the child as a perceived patient. Extended family not understanding. Yeah. These are all in the 100 comments too. Maybe not all of them, but a lot of the things that you're seeing. Totally true. So let's talk about what is autism spectrum disorder. It's a neurodevelopmental disorder that affects communication and social interaction. People with autism may have difficulty understanding and expressing emotions, as well as difficulty interpreting nonverbal cues such as facial expressions and body language. They have sensory processing issues, loud noises, bright lights. A lot of kids, including my son Lucas, wear headphones a lot. It's a spectrum, and the specific challenges and strengths of the individual will be different. And then it is, I think I have this here, but it's 1 in 44 now. When Lucas was diagnosed in 1999, it was 1 in 500. In the late 70s, it was thought to be 1 in 10,000. And now those stats of the 1 in 44 changed from 1 in 54 from 2 years prior, and that keeps getting more prevalent. But those are CDC studies that call up parents of 8-year-old kids throughout different states, and they say, has your 8-year-old ever been diagnosed with autism? And that's how they get it. So they've been measuring it the same way for at least, I'd say, 8 to 10 years. So it is pretty much comparing apples to apples. The 1979 studies and stuff obviously were a very different way. So when Lucas was diagnosed in 1999, we used the we didn't use it. The doctors used the DSM-4, and the DSM-5 started to be used in 2013. But there are a lot of differences between the DSM-4 and the DSM-5. The two big ones that I pulled out is that there's a broader diagnostic category. So the DSM-4 used to separate things in terms of classic autism or autistic disorder, Asperger's syndrome or Asperger's disorder, and PDD-NOS, pervasive developmental disorder not otherwise specified. It also included Rett and childhood disintegrative disorder. So those two were eliminated, but basically they put everybody under the autism spectrum disorder starting in 2013. That doesn't take away somebody coming in and saying, I'm an adult and I have Asperger's syndrome, because those were diagnosed prior to 2013 are still obviously valid. But it has caused a lot of confusion, and I'm going to show you like advocacy and issues with the media and all that stuff. And then the other big thing I think that DSM-5 did was it changed it to a severity rating scale, with level 1 being the mildest and level 3 being the most severe. So then we add media and social media. So in 1999, with the DSM-4 and the rate being 1 in 500, there weren't shows about kids or adults with autism. And there also wasn't social media. There was no Facebook, there was no Twitter, there was no, Instagram or anything like that. So when 2013 hit and Facebook was alive and well, I'm not sure about when the other social media organizations started, but Facebook was definitely up and running in 2013. And so a lot of people that were diagnosed as Asperger's and could advocate and could talk and could communicate via messaging, they started writing books that autism is just a difference, not a disability. Autism is a gift. Media started featuring characters like the Good Doctor, and then parents of kids like Kate Swenson from Finding Cooper's Voice. She has 1 million people on Facebook, and she's a good friend of mine, and she wrote a really good book called Forever Boy recently. She went on here. This is her famous viral video. She went on in her car and just talked about like the last time you think it's going to be okay. Like she was, her son is very severe. He just turned 12. And she's really in the thick of things. And she was in the thick of things since his diagnosis. And so she got a lot of hate mail, even death threats for saying that autism is hard and she doesn't, he has severe problem behaviors and those sorts of things. And also with the push of media and social media, especially social media, ABA, applied behavior analysis, which was and still is the most evidence-based treatment for children with autism, a sizable, we don't know how many people, but a very vocal minority of very high functioning, able to talk and converse. And they were saying that ABA, and they still are saying that ABA is abusive and that it's torture. And so now we add all of this stuff when little kids get a diagnosis or start to show signs and people start posting on social media, they're told avoid ABA and autism is a gift and you just have, and it just makes for more confusion. So struggles when you are parenting a child with autism, you get a lot of sleep deprivation. In many cases, some kids sleep through the night and are great sleepers. In our case, it wasn't the case. Lucas didn't sleep in his own bed through the night for like 10 years. So there's a lot of co-sleeping, a lot of musical beds and lack of intimacy, financial costs of treatments and care, reduced ability to go out as a family, as a couple or alone due to behaviors, inability to get babysitters that will get it or daycares that will accept it, fighting, advocating with insurance companies, with IEP teams, with each other. When I was the founding president of the Autism Society in my county, and my mom would come to some of the meetings, we met in person, and she's like, everybody's so angry. They're like fighting, and they're fighting with insurance and with these schools. And then they're even fighting with each other. Like they don't know when to stop fighting. Like they're just in this fight mode. Oh, I said financial burden twice. Well, that could be. Siblings. I talked about the future rate, the rate of autism in siblings is 1 in 5. There are sibling studies that are really good. If you live near a children's hospital that is part of that waiting list outside of school, schools don't tend to do real robust therapy. So a lot of people want extra therapy, childcare after school in summers, potty training and ADLs all can complicate that. Again, we have the different opinions and advice and ideas on what treatments to pursue, and then the ABA costs and controversy. Now, like I said, all 50 states do have insurance reform. But there are copays, and there are waiting lists, and then there's the added controversy. I did do a podcast episode on the 4 myths and truths about ABA. And I do tend to have, like, I had a BCBA who's also on the autism spectrum himself, and he's a special ed teacher. I did an interview with him. I've done lots of interviews with adults who are high functioning, but I say high functioning, that's even controversial because, within each person are their strengths and needs. So we don't really like to talk about like high functioning versus low functioning. But, the highly verbal, able to converse, able to write, and then accepting the diagnosis and severity level that could change with treatment, could change on its own, could change with medication. And then you get other conditions, comorbid conditions, anxiety, depression, intellectual disability is, I don't have the exact stat. I do have a video blog on intellectual disability and autism, which I probably have better stats. I'm thinking 20 to 30%. It may be, I'm thinking in that range. But if I say something that you're like, oh, that's really interesting, I wonder what she said about intellectual disability, just type in Mary autism plus your topic. So it would be autism, Mary autism plus intellectual disability, and you'll find my video blog or the podcast, or with the BCBA, who also is autistic. I like to say that your name is still in the lottery for additional stressors. Even though you picked out autism, the divorce rate is really high, supposedly. I don't know. I mean, I don't know if this is a great number or great study, or if there's multiple studies showing 80%. But then you have the stressors of co-parenting in different households. You also can have cancer, death of a loved one, job loss, mental health issues, elder care. I know several families who have a child with autism and the child develops cancer, the child develops diabetes, the child develops all kinds of things. And then the parents and the siblings can all, we're all only getting older. And so it's not so easy for you as couples therapists and psychologists to treat any of this because it's so multifactorial. Okay, so what does turning autism around mean, which is also controversial? Some people are like, what do you mean turn autism around? I don't want to turn my autism around. Autism is a gift. Well, I'm talking about delays. I'm talking about autism, level 3 autism. I'm talking about potty training, sleeping in your own bed through the night, going to school, keeping your clothes on, eating with utensils, talking, becoming conversational if possible. Like, this isn't, they said, would you want to turn bipolar around? Yeah, I think I would. I mean, as a nurse, as a behavior analyst with a PhD, as a mom, I'd want to turn anything around that's causing suffering or pain or not functioning at the best level. So what does turning autism around? It means increasing language, reducing problem behaviors, improving eating, sleeping, potty training, and so much more. It's a 4-step child-friendly ABA approach based on my background as a nurse, as a mom, as a BCBA, and as an online marketer, because as an online marketer, I know how to get my message out to the world. And I'm constantly learning more about that. And my goal for each child is that they are as safe, as independent, and as happy as possible, and that each child reaches his or her fullest potential, which is a moving target. Okay, so the 4-step approach, and you psychologists and couples therapists will easily identify this as basically the scientific method. We assess the problem, we plan, we teach or intervene, and we evaluate using easy data. So if you have a sleep problem, if you have a no talking problem, if you have a keeping your clothes on problem, we assess the situation, but we don't just assess the keeping the clothes on, we assess the whole child quickly and effectively, and then we make a plan, etc. And this is another diagram that I had somebody do based on it. This is my whole approach in a one-page document. Obviously, we're not going to go over it, but we work on language and learning skills. We work on problem behaviors, which includes safety awareness and major and minor problem behaviors. We work on self-care. We work on social and leisure play, safe, independent, happy, fullest potential. And then along here, it's assess and all the assessments we do, the plan, all the planning we do, the teaching. We use errorless teaching. We use a program, curriculum called the BB MAP assessment and curriculum. Once we get our assessments done, and then we evaluate using easy data. You know, families can only take so much data, and they can also only make changes based on really good, easy data. So before we move on to the 3 action steps, okay, so we do have, if you have any questions, we're going to have a question and answer period at the end, but just throw in some. So what is ABA? ABA is applied behavior analysis. It is the science of changing socially significant behavior. It wasn't invented for kids with autism. It's a science. So it's just like gravity. If you reinforce a behavior, it will go up. If you don't reinforce it, it should go down. But there's a lot of different flavors of ABA, just like there's a lot of different methods that psychologists use or couples counselors use. There's different ways to treat things, but ABA, you know, if a child is making progress, is happy during therapy, and is happy to see the therapist or happy to go to school, and they're making progress, they are using the principles of ABA. It's a science, but it's also, ABA is not just a science, it's also a treatment package for kids with autism. So I use applied behavior analysis. I use Skinner's analysis of verbal behavior, or the verbal behavior approach. And I use my 4-step turn autism around approach, which is more simplified and more step-by-step. And I'm going to show you some videos of some kids, and all throughout my courses, I show videos, I show examples, and we put people through the process. So I would say Skinner is the most famous behaviorist. And errorless teaching is not to, like, if a child doesn't know this is water, not to say, what is it? Or 2 + 2, what does that equal? 2 + 2, you know, the child doesn't know it. So an errorless way to teach this would be water, 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 and you give the child water. That's the 1 word up to 3 times strategy, whether the child says it or not. And then if they do say it, they get it on the first try. 2 + 2 = 4. What's 2 + 2? 4. So we basically give the answer, and we use what we call a transfer trial to get the answer again with less of a prompt. Would this system work for an older child who is recently diagnosed age 12? So my courses and my books work for kids and adults who are not conversational, who are functioning at a 1 to 5-year-old level. So I would imagine that a 12-year-old that's newly diagnosed has kind of become conversational, slipped through the cracks, you know, like, not that these procedures wouldn't work. And I do have some podcasts with higher language people that could help. But in terms of, like, actually my book, unless they're having, like, problems with language, with potty training, with sleep, with picky eating, you know, my book is more for kids 1 to 5, either chronologically and or developmentally. So my 26-year-old is still not conversational. He still is functioning and still has trouble with some of those areas. Is there a fine line between ADHD and ASD in terms of symptoms, diagnosis, treatment, considerations? Yeah, there's a really fine line, especially when the child is very small, like 2 or 3. And I personally believe, I can't diagnose any of it, but I personally believe that little children under the age of 5 really should not be diagnosed with ADHD. Because I've seen it many times where, the child will be 5 and they'll have ADHD, sensory processing disorder, and speech and language delay. It's like, that's autism. That's not 3 different things. Actually, the developmental pediatrician that Lucas was diagnosed with, Dr. Copeland, he did a really good podcast interview with me a few years ago. And he never was about like putting in an ADHD diagnosis on a child with autism. He thinks autism spectrum disorder really encompasses ADHD, sensory processing, language delays. I do think that additional diagnoses of OCD, bipolar, anxiety and depression are common and probably needed for many kids, but definitely I would think over 5 once they're conversational, if they become conversational. How beneficial do you think are parents of children with autism support groups? Well, it was very good in the beginning. And now my local autism society that I was founded with a small group of other women, they offer music therapy groups and movie time, sensory movie time. So they're great local ones. And then online ones, Kate Swenson from Finding Cooper's Voice, she has Coop's Troops, which is just a few dollars a month. And it's a way to really network with other people. So I do think that it is good to either encourage people to do it locally and or online. Yeah, level 1 diagnosis on the 12-year-old. Yeah. So, I mean, not that there's nothing in my things that are helpful. But yeah, there are several interviews with people who are older, who are functioning really well. So you could, search for teenager, Mary, autism, teenager, level 1, high functioning, and you can listen to a few things. And errorless teaching could be applied to couples therapy. Give them the answer, then prompt them, then don't prompt them, answer. Yeah. I mean, errorless teaching is great for everybody. And yeah, so there's everything in my programs that's applicable to everybody, regardless of diagnosis. Okay, so here's some 3 action steps. Again, not for you to actually do the therapy, but just to know kind of my approach. So action step number 1 is we always need to focus on the right things in the right order. Here's little Jacob. I worked with him for a few years. So where is your child or client at in terms of language, leisure skills, academic, social skills, eating and sleeping, problem behavior, self-care, inclusion, safety awareness, and happiness. And if they have a diagnosis, what level are they on, and that sort of thing. Now, I created this 1-page assessment 18 years ago. It's in both of my books. The most recent book, it looks like this. Now, I have spent the last year investing a lot of time and money into creating a digital assessment based on this 1-page form. And you can get that digital assessment or encourage your clients of parents of children with autism or toddlers showing signs to complete it at marybarbera.com/free assessment. Once they complete it, it will take them 10 minutes and they will get a printout that looks like this with 3 scores. And we have just launched this in the fall of 2022. So it's very, scores aren't valid, validated. They are pretty valid. They are pretty, if you have a child who's functioning like the 12-year-old example, if you do this on your 12-year-old, you're probably going to get, near 100% in self-care and in language. Problem behaviors may be a problem. And of which case, if he's having problem behaviors, then the demands are too high, reinforcement's too low. We do have a mini course called Turn Tantrums Around, which may be appropriate, but do the assessment, get your scores, and if there's any question, you can always email us. So we take that assessment and we teach parents and professionals how to turn it into a plan based on the child's strengths and needs and create a plan Here's Chino. I worked with him. He was only 20 months of age when I started working with him. And mom was stressed. She had 3 kids under 3. They were a bilingual family, Spanish and English, living in the United States near me. She wasn't thinking autism when I went in as his early intervention professional. I completed the STAT, the screening tool for autism in toddlers, developed by Wendy Stone in the chat, if you've heard of this. It's a series of 12 or 13 subtests. Here's the doll subtest. When I was working with Chino for a few months, I did this doll subtest here. All he has to do, he doesn't have to say anything. He just has to put the doll in the bed or feed the doll or do something. So I'm just going to show you a little clip. And this is all scripted out like the ADOS.
My doll.
So I can say, look at my doll. I can't say, put the doll in the bed or feed the doll or the doll's hungry. I could just say, look at my doll. And I could give him 5 chances to get the doll to do something. So stirring the cup doesn't count. Sucking on the bottle himself doesn't count. He even tried to sit in my little chair behind him, the little doll chair. So he failed the whole, that whole test, the whole subtest. It took about 30 minutes. He had no words heard during the whole 30 minutes. He failed every subtest and got a 4 out of 4, which was the worst score. He did then get on a waiting list and waited 6 months for a diagnosis. He got diagnosed with moderate to severe autism. He, out of all the hundreds of clients that I've worked with directly, he reminded me the most of Lucas when he was 20 months of age. Like, he looked okay, wasn't doing anything really, really all that different. He had some pop out words, and here he is with his therapist who was doing the kind of table time that eventually we do with kids.
Point to cat. Good job. What's this? Touch mouth. Touch knees. Good job. What color? Good. What color? Red. Good. What's this? Good. Say daddy. Good job. Touch head. Touch head. Good job. Show me knocking. Good job.
So from these videos, I realized that every time we got to a body part, touch body part, or say a body part, he was not fluent with it. His latency was bad. So we actually, my dissertation is on fluency, the effects of fluency on learning. And so we put whole fluency programs in place for body parts, touching body parts, saying body parts names, and then we pushed it back in and he did so much better. So those are the kind of interactions. We didn't play with dolls with him. He did have an older sister, like a year older, so she may have exposed him to dolls. He never saw that doll test again or the stat test again. But 1 year later, almost to the day, when he was, so the first video was he was just about 2 or on his 2nd birthday around. This was about on his 3rd birthday. And I brought the stat back, even though the stat is not to be used for like a pre and post thing. I think it should be, because I think it shows some of the real gains. But here he is with the doll play.
Doll. Look at my doll. With my doll.
Okay, so he passes right away, and now he says night night. So the subtest could be over with a pass, but we kept the camera rolling just to see some of his gains. He covered the doll. Mom is sitting in the background, literally in tears.
Good night, baby. Ah, you give me kisses. Wake up. Good night.
And the other thing we didn't teach him is we didn't teach him to talk in sentences. So here he is saying Coco, but I don't understand what he's saying. And he's pointing and he's trying to like tell me better.
I'll make Coco. Okay.
And his mom made Coco for him and his sister. And so just like the huge gains he made, he went on to do really well. He is bilingual. He is fully conversational and fully bilingual. His mom was on the podcast, so you can search for Chino's mom if you want to listen to that. But so I am trained and certified in the STAT. I actually forgot about that training and certification until I wanted to look at another client that I'm not going to show you, but I had the STAT bag in my car. We knew that, Chino was probably going to get a diagnosis, but I couldn't tell with the other child, but I was like, he needs a STAT. I'm like, I used to do the STAT. So I pulled it out. I'm trained in the ADOS too, the Autism Diagnostic Observation Schedule, but I was never certified in that. And that really needs to be done in a clinical, more sterile situation. But the STAT is great because it can be done in homes and schools where the environment's not as sanitized. Okay, so action step number 1 is you got to work on the right things in the right order. Action step number 2 is we want to spend 95% of our time preventing problem behaviors, not reacting to problem behaviors. And I think that's going to be key when you're trying to counsel couples. So here is a video that mom took of a little girl, and I'm just going to show you like 5 seconds of this. Okay. So we have no idea what's going on, right? We can't tell how old this girl is, what her situation is, why is she crying? Did mom just tell her to get her shoes on? Does she not want to take a bath? Does she want candy and mom told her no? We don't know if she can talk. We don't know if she can get herself dressed, if she's potty trained. Like, we don't know anything about her. So offering any kind of reactionary strategy of what mom should do, there's a whole lot more. We need to know what is going on with this child. So this is Faith. That's who was crying. I worked with her 2 brothers who are a few years older than her. They both are on the autism spectrum. She was in the sibling study. She got a diagnosis at 2. She had another behavior analyst work with her for a year, didn't make a ton of progress. And so when she was 3, I began working with her. And she didn't have like a co-control of, I say this, you say that. She didn't have that. She wouldn't sit at a table for any length of time. She just wasn't cooperative. She wasn't potty trained. She had just turned 3 though, but mom was very excited about trying to potty train her because she was getting an extra bill from the daycare because she wasn't potty trained. So we are going to prevent problem behaviors by doing that assessment and the plan, having table time, developing a COA control, and working on potty at the same time. She is in the kitchen, where if she pees in her underwear, it's not that big of a deal. So I'll just show you a little clip of what therapy looks like.
Do this. Awesome. Do this. What's this? No, you're so smart. Do this. Good job. What's this called? Oh, you bears. Can you dump them in? Dump them in.
The little reinforcement system.
Would you like milk or fish?
We need to have reinforcement at the table. There's her and her 2 brothers in the natural environment working on bubbles and with some play. So applied behavior analysis is the science of changing socially significant behavior. So we're always looking at improving language and learning skills while reducing problem behaviors. And basically it's 2 sides of the same coin. Like if I would have gone in there after seeing that video of her screaming and just worked on problem behaviors, I would have gotten nowhere. So the two sides of the same coin just pretty much say that everybody, you just need to work on 95% of your time improving things like language and learning skills so that her problem behaviors fade away. And action step number 3 is to collaborate with other parents and professionals. I do believe that one parent needs to be the captain of the ship. And I have seen it in some of those responses about couples therapists is like train both parents, have both parents go hand in hand, up the mountain together. That would be nice and ideal, but like usually one person is working full time and the other person is home more. And the person, if one person's in major denial and the other person can read the book, like we've had interviews where that's the case, like somebody just gets my book to learn themselves. I also think as therapists and counselors, I've heard stories where, it's our policy that the child comes in alone and mom waits in the waiting room. And meanwhile, it's like, yeah, that doesn't work. So, we really coach our parents in our online course and community and membership to be that captain, to be that advocate, to be like, no, my child's 2. They don't talk. I'm not sending them anywhere by themselves. Like I'm their voice. And I want to know what you're doing. And if you're not pairing with positivity and like crying, if a child's crying, they're not learning. And so I'm all about like, there's not a cry it out procedure. There's not keep the demand on. There's nothing like that. It's all positive and child friendly. If we get crying, we want to get out of the crying and we want to learn how to prevent the crying. So my goal for both Lucas and Spencer, Spencer right now is in med school and Lucas is at home. They're 26 and 25. I want both of them to be as safe, as independent, as happy as possible, reach their fullest potential. Safety for Lucas versus Spencer looks really different. Independence looks different.